Let's talk about varicocele. So varicocele is dilatation of the pemphiform plexus here. This is the pemphiform plexus. It is more common on the left side, and the left testis normally is at a lower level than the right testis. And the reason for that is because of the increased pressure in the left renal vein. So because the left gonadal vein drains through the left renal vein, and the left renal vein is a more higher pressure than the inferior vena cava, which kind of drains the right kidney through the right gonadal vein. And so this is the reason that because of the increased pressure, the left testis is at a lower level normally. So also the varicocele is more common on the left testes, and the reason for that is because the SMA, this is the superior mesenteric artery here, and this is the aorta. And the superior mesenteric artery arises from the front of the aorta, and it passes in front of the left renal vein, and hence the renal vein, the left renal vein can get compressed between the two, the superior mesenteric artery and the aorta. So between the two, the left renal vein will get compressed, and that results in increased pressure here, and that pressure will be transmitted this way, and then the blood will flow in a retrograde direction this way, and that would result in result in dilatation of the pemphiform plexus, and that results in the varicocele. So then what will happen when the patient is supine? Like what are the conditions that will result in decreased swelling? So the mass or the swelling will be decreased in supine position. Okay, when the patient is supine, the blood will flow in the normal direction in this way, and that will result in decreased swelling because the blood is flowing away from the pemphiform plexus towards the left renal vein, and so. And standing will increase the swelling, because when the patient stands, then that will result in increased gravitational force this way, and that will result in increased swelling. Also, while solo maneuver and the patient holds breath can also increase the swelling. Then another thing that can happen with varicocele is infertility, and the reason for that is because of the increased temperature around the testes. Here we have the blood. So when there is increased blood, there will be increased temperature. And when there is increased temperature, there will be decreased sperm count and decreased sperm motility. And both of these will result in infertility. And it can also result in testicular atrophy. Then in order to diagnosis it, for diagnosis, we will do ultrasound, and ultrasound will show retrograde flow, or flow in this direction here. So, and also there will be the ultrasound will also show dilatation of these pemphiform plexus. So diagnosis will be done by ultrasound. And then the treatment. For the treatment, there are two options. So now, if the patient is young, he will obviously desire fertility, and so the treatment in that case is gonadal vein ligation. So when this vein is ligated, the left gonadal vein, then that will result in there will be no flow in this direction, and hence the dilatation will there will be no dilatation here, and so that will result in treatment of the varicocele. Then, if a patient is old and does not desire fertility, or does not wish to have more children, then the treatment options include NSAIDs, just for the pain relief or discomfort, or another treatment. So now for the old patient, you can just give scrotal support. It will alleviate the testes and it will relieve the discomfort. So to differentiate varicocele from hydrocele, which is another testicular swelling in which there is fluid around the testes, the test to do is called the Trans-Illumination Test. And in case of varicocele, there will be no trans-illumination, while in case of varicocele, in case of hydrocele, there will be trans-illumination. So this is one way to differentiate varicocele from hydrocele. So hope this was helpful.